Hello. Welcome to Health, Medicine, and Sex. I am Dr. Jonathan Lazare, and I am a urologist in New York City. Today's show is about how to cure erectile dysfunction. Now, I know that erectile dysfunction is a sensitive topic. If you suffer from erectile dysfunction, or ED for short, there are various medical treatments that will enable you to have a normal sex life. With proper treatment, virtually every man can have an erection without exception. I treat erectile dysfunction in a stepwise fashion. The first steps are designed for the milder cases and the treatments are less invasive. If the first treatment doesn't work, then we proceed up the treatment ladder. So let's begin. The first step in treating erectile dysfunction, or ED, is getting into shape. Studies show that obese men with erectile dysfunction have better erections when they diet, exercise, and lose weight. And this makes sense because sex is a vigorous exercise. Those who perform best are in the best physical condition. The next step in treating erectile dysfunction is the pills, Viagra, Cialis, and Levitra. They work in about 50% of the cases. Cialis lasts the longest, about 36 hours, which is why people in France refer to Cialis as le weekend. These are generally safe medications with a few precautions. Never take the pills if you're on nitrites or nitrates for chest pain, also known as angina. Never purchase the pills from the internet because you don't know what you're getting. And never exceed the maximum daily dose. Now, the next treatment step is the penile erection device. The vacuum erection device involves the patient placing the penis inside a cylinder in which a vacuum has been created. The vacuum draws blood into the penis. The patient then places a clamp around the base of the penis in order to maintain the erection. This clamp must be removed in a half an hour. The problem is if the patient fails to remove the clamp for any reason, the penis can lose its blood supply and the penis can be severely damaged. I hesitate to prescribe this device due to safety concerns. So let's continue. But first, I have a question for you, the viewer. Did you ever wonder how men who star in adult internet videos maintain their erections despite the presence of an entire filming crew? Well, the answer is penile self-injection therapy. Let's take a look at this cross-section of the penis. The patient is taught to self-inject through a very tiny needle the side of his penis at the 3 or the 9 o'clock position. The needle enters the corpora, which are two cylinders that run the full length of the penis. It is the corpora that fill with blood during the erection. The patient injects a medicine called prostaglandin E1. The treatment is highly effective in the vast majority of patients. The main side effect is priapism, or an erection that will not go away. Fortunately, this is a rare event. And now the final step on the treatment ladder is the penile implant. The penile implant is a great operation. Patient satisfaction is over 90%. Let's take a look at the implant. This is a view of the three-piece penile implant. It consists of two cylinders which go inside the penis, a reservoir which goes in front of the urinary bladder, and a pump which goes inside the scrotum. When the patient wishes to have sex, he compresses the pump in the scrotum, and water is transferred from the reservoir to the cylinders, and the penis becomes hard. When the patient is finished with sex, he compresses the release valve, which is also in the scrotum, and water returns from the cylinders back to the reservoir, and the penis becomes soft. The beauty of the device is that the penis is 100% hard during sex and 100% soft when the patient is not having sex. So what exactly does it feel like having a penile implant? It feels like you're having your own erection. Penile sensation is normal. Orgasm is normal. Fertility is normal. Yes, you can even get a woman pregnant with the penile implant. Is this a big operation? Not really. All of the components are inserted through an incision that's in the scrotum, and the incision is only 1.5 inches long. All of the components are placed underneath the skin, so nobody has to know that you have the implant, including your sex partner. The operation takes about 1.5 hours, and you go home the same day of the surgery, a few hours after the operation is completed. The most important complication is infection. Infection occurs in about 2% of patients. If the implant becomes infected, it may have to be removed. Finally, it is very important to select a surgeon who's performed many penile implants. In New York City, there's about 6 urologists, including myself, who have significant implant experience. And that brings to a conclusion our show on the treatment of erectile dysfunction. Please remember that erectile dysfunction is treatable almost 100% of the time, and no matter how old you are, you can have a good sex life. Thank you very much for joining me. Please join me for my next show. Goodbye.